and a panel of experts. We're going to hopefully give you and your family some very important information about COVID testing, impact on young people, and also on some of the housing issues and tenant protections tonight. California is ranked 6th in the world on vaccinations administered, which is great news. I just learned today that a lot of the healthcare providers are feeling that mid-April we might actually have a supply, we may not have demand to meet the supply. And so that's a good problem to have in a month away, that we're going to have enough vaccines where we're not going to have enough people signed up, and there's some concerns about the refrigeration issues. And so we're going to talk with our experts about that tonight. We have, as I said, a number of great panelists. The website to sign up for your vaccine is available in 12 languages, including Spanish, Armenian, Korean, Chinese, and Japanese. If eligible, you can proceed with scheduling. And I was pleased to join the supervisor to tour the vaccination site in Magic Mountain, which was very, very impressive. So thank you, Supervisor, for inviting me to do that. Obviously, I represent the 25th State Senate District, which stretches from Sunland, Tujunga to Upland. And I know we have a lot of residents on the line with us tonight. So with that, I'm going to turn it over to my friend and colleague, Supervisor Barger.
Thank you, Senator Portantino. I can't think of anyone that I'd want to do a town hall with, and thank you for inviting me to be a part of this. I'm grateful for the opportunity to share an update with our constituents on the vaccination efforts underway in Los Angeles County, and to provide information regarding rent relief and eviction moratoriums from local perspective. I know that's something my office gets a lot of questions on. As the chair of the Board of Supervisors last year, I was tasked with directing how LA County and its departments managed the pandemic. The county continues to work with its local, state, and our federal partners to address issues as they arise, and to ensure that we are able to offer adequate testing, which is still needed, hospital capacity, which is going down, contact tracing, which is increasing as we get better at identifying how to really address finding the people who have been in contact. And of course, what Senator Portantino talked about, and that's vaccine distribution. We are also focused on safely reopening the economy and getting people back to work. And I emphasize safely, because if we don't do it right, we're going to go back into a shutdown. Additionally, we want to ensure children can return to in-person learning, making sure that teachers are getting access to the vaccine as well. I've heard from countless parents and even a number of students who've expressed their frustration with the ongoing distance learning and the impact it's had on the social and emotional well-being of our children. I know many of you joining us this evening are eager to learn more about our efforts, and I say our efforts collectively. I work very closely with Senator Portantino, especially as it relates to pediatric perspective on the vaccine and plans for reopening the schools. On the vaccine rollout, while initially we did face challenges when we began rolling out the vaccine at the beginning of the year, we have turned a corner and are more effectively getting the vaccine into our communities. As of the end of last week, Los Angeles County had distributed approximately 3.2 million vaccine doses. Nearly 30% of our residents have received at least one dose of the vaccine, and 10% of our residents are fully inoculated. We are not letting doses go to waste. 92, and I think it's even up to 94% of all our doses received have been administered. In addition, we received some allocations of the Johnson & Johnson vaccine, which I believe is going to be a game changer. This vaccine only requires one shot for patients to be fully inoculated and does not have any cold storage requirements. I want to emphasize that this is not a less effective vaccine, and in trials, it's prevented all cases from leading to hospitalizations. While there are some supply shortages, we are already able to distribute 25,000 doses of Johnson & Johnson vaccine. There's still a big task ahead of us, especially to ensure the vaccine is accessible to all populations and to increase the federal supply as we receive it. And I'm confident in the efficient system in place. So with that, I look forward to being a part of this. And again, thank you, Senator Portantino, for including me.
No, thank you, Supervisor. For the public, it would be surprised to no one that not every politician likes each other. But in this case, the supervisor and I are not just colleagues, but we're friends, and we work very, very well together, representing our districts. And it's I tell people it's what government should be. People, talking and working, and our staffs collaborate. So this is a great partnership for everyone. We're going to try to answer as many questions tonight as possible. As the supervisor articulated, we started out, not as great as we should have been with the vaccine rollout, but it really has vastly improved, and it's going to continue to get better. I talked to somebody the other day who got the Johnson & Johnson vaccine, and they were ecstatic. And so whatever one you're eligible to get, whatever one is available, please take the time to get it. Supply has been the issue, but that's going to change shortly. So we're going to continue our program. We've got some outstanding speakers. Our first presenter is Patricia Sung, and she is an infectious disease trained epidemiologist with a certification in infection control. She earned her Master's of Public Health degree at the University of Southern California and worked in healthcare outreach unit in the Los Angeles County Department of Public Health for 10 years. In her current role as manager of infection prevention and control at USC Verdugo Hills Hospital, she has worked to implement protocols to empower clinical staff in the prevention of healthcare associated infections. She's going to present an overview, and then we're going to do some Q&A after our second speaker finishes her presentation, and I'll give you the bio of our second speaker after we hear from our first. So let's go.
Hello there, my name is Patricia Sung. As Senator Portantino just introduced, I'm going to be giving a very brief overview of vaccination for COVID. Are you able to see my screen?
I see you.
Okay, let's see.
Bear with us, everyone.
Sorry about that. How about now?
No. While you're doing that, I'll just, Anthony, there was someone who put something up in the chat regarding Dodger Stadium, and I know that they've had challenges on the wait, but they are trying to perfect it, and I think they are streamlining and making some of the pods smaller in order to streamline and make the wait less. And now we see your documents up here. So thank you, Doctor.
Great. Apologies for the delay. So there are 3 currently approved vaccines in the U.S., 2 mRNA vaccines that are given in a 2-dose immunization, 21 and 28 days apart. They are 95 and 94% effective at preventing severe to critical disease and are approved for adolescents and adults. The third is the Johnson & Johnson vaccine that is administered in 1 dose and approved in individuals 18 years and up and is 85% effective in preventing severe to critical disease. I do want to note that Moderna is currently conducting clinical trials in children ages 12 to 17 years with data expected sometime this summer. And then this month has begun to study the vaccine efficacy in children 6 months to 11 years. Pfizer is also testing its vaccine in children 12 to 15 years, and data is also expected sometime this summer. So there's 3 different vaccines, but they do confer immunity in slightly different ways. Both the Pfizer and the Moderna vaccine utilize similar mRNA technology to induce the immune response in the vaccine. A piece of mRNA, a piece of the virus, is wrapped in a protective coating, and it delivers the recipe for cells to begin making a harmless protein that is unique to the COVID-19 virus. Johnson & Johnson's vaccine uses a slightly different mechanism. It uses an inactive adenovirus cell to contain a piece of a double-stranded mRNA that also contains the recipe for cells to begin making the same harmless protein unique to the virus that causes COVID-19. Both types of vaccines activate the immune system's response to the spike protein and teach your body how to recognize the real virus and fight it off. And while initial studies focused on severe and critical COVID-19 infection, preliminary studies are showing COVID-19 vaccination may also protect against asymptomatic infection. Viruses constantly change through mutation, and new variants are expected to occur over time, and the virus that causes COVID-19 is no different. Sometimes new variants emerge and disappear, and other times new variants emerge and persist. Multiple variants of the virus that cause COVID-19 have been documented in the US and globally during this pandemic. CDC and other health agencies continue to study these variants to learn more about whether the variants spread more easily, cause milder or more severe disease, if they will respond to medicines currently being used to treat people for COVID-19 infection, and if it will change the effectiveness of COVID-19 vaccines. So far, studies suggest that antibodies generated through vaccination with the currently authorized vaccines do recognize these variants and continue to protect individuals. So with the option of multiple vaccines, a question frequently asked is, which one should I get? And is one better than the other at protecting me from this infection? And while we're still early in the vaccine phase of the pandemic, and in order to contain the variants and prevent further spread, it is recommended that you take the vaccine that is offered when it's your turn. Public health does not recommend vaccine shopping or waiting for a particular brand that you think might be a bit more efficacious against COVID. And while California has dispensed an incredible 15 million doses of vaccine, that's still roughly 13% of the population that is fully vaccinated, and is far below the protective herd immunity threshold to really contain the spread of COVID-19 infection. Also, the sooner eligible populations are vaccinated, the greater the protection for those that can't currently be vaccinated, such as children, particularly children going back to school. The good news is that while we're still learning how vaccines will affect the spread of COVID-19, we will continue to take the same precautions after you've been fully vaccinated. You want to wear a mask, stay 6 feet apart, and avoid crowds and poorly ventilated spaces. However, recently, CDC guidance has changed to allow fully vaccinated individuals to gather indoors without masks and without physical distancing, as well as permit the indoor unmasked visitation with unvaccinated people from a single household who are at low risk for severe COVID-19. So these are all risk assessments you may want to take into consideration as you decide to gather or not once you've been fully vaccinated. Thank you.
No, Senator Portantino is supposed to introduce this. Like he's on mute.
You're on mute.
I wanted to say thank you, Patricia, and I know we're going to have some questions after we hear from our second speaker. The supervisor and I deeply care about the health and welfare of our young people, and so we wanted to, there's been a lot of conversation. We wanted to make sure that we dealt with our young people, and so we have experts here with us to talk about that. We're going to get to Q&A after. As the supervisor mentioned, we're trying desperately to open up our schools safely. The state just allocated $6.6 billion, which included $2 billion for safety measures. And there's lots of prioritization to accelerate vaccinations by setting aside 10% for K-12 school staff. So our next speaker is Dr. Pia Panaraj. She's an associate professor of clinical pediatrics and molecular microbiology and immunology at Keck School of Medicine, University of Southern California. So for all the USC folks out there, we've got one. She is a disease specialist at Children's Hospital Los Angeles and serves as director of Pediatric Immunization Advancement Laboratory and Pediatric Global Health Education Program. She's a global research focuses on maternal and infant vaccinations, optimizing strategies in the community setting and improving vaccine immunity. She serves on the board of directors for the California Immunization Coalition, and she's going to share a perspective with us today. So thanks, Doctor, for being here.
Great. Thank you, Senator and Supervisor, for having me here today. So I was asked to talk about pediatric trials and what's going on with kids. So, you know, now that the adults have their vaccines, our next focus definitely is on children. So as Dr. Sung mentioned just a little bit ago, Pfizer has started their ongoing trials down to 12 years old. That actually started earlier this year. And we hope that we'll actually have some data by early summer and possibly even have an approved vaccine for those, you know, middle school and high school kids by the fall for the incoming fall school year, which would be wonderful. And at the very least, hopefully they'll be available for high-risk kids. And then Moderna has actually started their phase 2 to 3 safety trials in children down to 6 months old, so just little babies. And they are, pediatrics, children are just not little adults. We need more information about them. We need to really understand what's safe in them. So it starts with, especially for these younger children, starting with a small dose and kind of ramping up just little by little to see what the perfect dose is so that we get the best immunity, but with very little side effects. And so that's why we can't just say, okay, that we know the vaccine works in adults and now let's just give it to children. We really need to do those studies to make sure that we find the perfect dose for the children to protect them. And then the other Johnson & Johnson, as you know, that vaccine was just approved for adults. They will start some pediatric trials. They have that upcoming with hopefully some data by September. And then there's 2 more companies, AstraZeneca and Novavax, that are just right behind them. So, you know, probably by the end of the year, we'll have a lot more information and hopefully we know the right dosing that's safe and effective for the young children. So I get a lot of questions about, well, okay, so there's no vaccines for the children. Is it okay for them to go back to school? And the thing is, what we do know is that there were several cities and counties around the country and in other areas of the world where they did not shut down schools or they have reopened already. And in those places, we've seen that, yes, there's some infection in children, but it's not more than what we see out in the normal community. And so there isn't any evidence that having those children back in school actually increases or accelerates the number of cases in the community. And there really haven't been a significant number of transmission in the school. So I think that that's really important to remember, especially as schools are just starting to open up now, and they're taking quite a lot of precautions. And so with those precautions in place, you know, the masking, social distancing, cohorting precautions, that is really helpful to keep those transmission rates down. I think the schools are learning as we are, and they're opening little by little with just small steps at a time. And children are they need to be around other kids and with their teachers, and we just need to find the right precautions to make sure that they stay safe while doing that. So that's what I was asked to talk about, and I'm happy to take any questions.
All right. Well, I think, Senator Portantino, I've got a question for Dr. Sung that was submitted. And the question is, currently type 2 diabetes is on the list of identified health conditions. What is the difference between type 1 and type 2 that only type 2 is currently on the list to be vaccinated?
Without getting into the details about the differences between type 1 and type 2, really what it comes down to sometimes is that type 2 diabetes can be associated with other comorbidities in an individual that may increase their risk for severe COVID-19 disease. And so while I know that individuals with type 1 diabetes may feel very strongly that they are also at risk, it also takes into account many other factors that may impact that patient's risk for severe COVID.
Thank you. I think I have the next question, and it's for Dr. Panaraj. But before I do that, I was on an earlier Zoom today, and one of the parents of a teenager was talking about how excited her child was to go back to see her friends. And they talked about how over the pandemic, they all got acne, so they all look the same. And the young person was excited that she wasn't the only person with acne, because when she went to school, she saw everyone else had acne. And so just that little thing made her feel better about herself. So anyway, I share that as a dad. Dr. Panaraj, are children with pre-existing disease, genetic disorders, or developmental disorders more susceptible to contacting multi-system inflammatory syndrome in children associated with COVID-19? That question came into us as well.
So the multi-system inflammatory syndrome in children, or MIS-C, you've probably read about it in the newspapers. It's an inflammatory syndrome, or basically inflammation that happens several weeks after the acute COVID infection. So you may have COVID, have a little bit of runny nose, cough, fever, or nothing at all, and then recover and be fine, but several weeks later develop MIS-C. And it's actually, we see it in normal children as well as those with pre-existing conditions. So the quick answer is no. Those with pre-existing diseases are not more likely to get MIS-C. There's a risk that kind of across the board. The other question that I get asked a lot is, if we have the vaccine, is there a possibility of MIS-C in children? And the answer is that there's no reason to think that that's going to happen from the vaccine alone. But of course, these are one of the things that we are monitoring closely.
Thank you.
Very good. There was one question. I know that Dr. Sung went over the difference between the three vaccines, and I really appreciate that, because I think it's important not to shop around for vaccines. So I'm going to skip that question because I think you explained it, and go on to the question for Dr. Sung. Is there a difference between receiving the dosage in one shot or two shots? We get asked that question because we're finding that some people are showing up to get one Moderna and not showing up for the second. How does it affect the body?
Great question. For the Pfizer and the Moderna, the two doses are part of that ability to induce that immune response. And the way those are designed, one is what we would call the loading dose that kind of primes your immune system. And then the second dose, 21 or 28 days later, is the booster shot that really fully activates your immune system versus the Johnson & Johnson that just requires the one dose to induce that same immune response. So that may account for some of the differences in the response that are being documented in studies. But across the board, all three are protective for individuals against COVID.
Thank you.
Thank you. And I'll go back to, we got another question, and this is for Dr. Panaraj. If both parents are vaccinated and they have a 12-year-old child who is not vaccinated, what are the dangers for that child? How should they interact if the two parents are vaccinated but the child isn't?
Yeah, that scenario is going to come up quite a bit right now because the vaccines are available for adults, but not for children. So, you know, the parents can get together with other parents, socialize in the way that it was recommended by the CDC just a few weeks ago, maybe about 2 weeks ago. They put out some guidelines that if you're vaccinated, you can visit with another low-risk family that may or may not have received a vaccine, for example. But when you are out and about, you are at risk. Even if you're vaccinated, there's a possibility that you can still carry the virus. That means that you won't get severe disease, but it's possible that you can give it to somebody else, such as your child who's unvaccinated, and they can get severe disease, especially if your child has any underlying conditions or any additional risk. So that being said, I think that it is important, to be able to see people, but do it with caution. Keep those masks on as best you can. See them outside if you can. Do what you need to do to protect your child at home who has not yet received his or her vaccine.
Great.
Very good. I have for Dr. Sung. Is there any research on individuals who have received the COVID vaccine, and what does it show, which I think you talked about in terms of efficacy, but can you still get COVID after you have been vaccinated? I think that's the key question in terms of the 95% and what is protecting you against, or 94, 95%.
Yes, it's not uncommon with other vaccine preventable diseases that for a chance of infection after immunization called breakthrough disease. It is rare, but it is not uncommon. And it would not be unreasonable to expect similar results from a COVID-19 vaccine. So that's why, as Dr. Panaraj just mentioned, keeping to some of these public health recommended guidance even after vaccination is still important at this time.
Great. We covered the clinical trials for children in your presentation, Dr. Panaraj. I'm going to take a question in the chat. Did you see the one? I'm an asthma person and was infected in 2019 and survived the virus. Should I get vaccinated, or do I still have the antibodies? Did you see that question? Do you have a take on that?
Oh, sure. Yes. So for anybody who previously had the virus, the infection, you can be vaccinated. The recommendation was to wait 3 months because your antibody will at least last that long, and there's a vaccine shortage at this time. But there's really no danger of you receiving the vaccine too early or right away. The only reason for the waiting 3 months is because we want enough vaccine to be able to get around to as many people as possible.
Great, thank you.
And then I see a question regarding the Johnson & Johnson vaccine in the city. They're saying they only see it in the city of Los Angeles, but in fact, the Johnson & Johnson came into LA County. I know CVS was offering it. I know some of the county sites were offering it. And so it's not just the city of LA. The problem is that we don't have any Johnson & Johnson coming in probably till next week. We're hoping to get a lot, and it's going to be throughout the entire region. But again, as was stated, we hope you won't vaccine shop. All vaccines are effective, and it's important for us to prioritize getting people vaccinated. But Johnson & Johnson is going to be available throughout the entire county and has been, in fact, not just the city of LA.
Great. And Catherine, I think you have the next question for Patricia Sung, or
that was all the questions that were submitted. Yeah, in terms of
Patricia. Okay.
Yeah.
Okay. There's one more, I think, for Dr. Panaraj. Why are children with trach and ventilator dependent not eligible to be vaccinated?
So if the child is 16 years old or older, they can be vaccinated with the Pfizer vaccine because they would be considered high risk. If they're younger than that, then we really need those studies, those pediatric studies, to show us what's the right dose, what is, and to make sure that it's safe. And once we have that data, then definitely that the child who is ventilator dependent would definitely be considered high risk and should get the vaccine for sure.
Great. And just one real quick question. One of the questions in the chat was, what is considered high risk? Children, could you talk a little bit about the category of children under the age of 12 that are high risk? What are some of the risk factors?
Sure, yeah. So high risk would be anybody with a pre-existing condition. So diabetes, for example, was mentioned earlier. Anybody with cancer, a rheumatologic illness, or a gastrointestinal illness that requires them to be on some kind of medicine that suppresses their immune system and makes their immune system not act very well. So all of those would be considered high risk. There is a list of conditions on the Los Angeles Public Health website for adults, and this would be basically when there's a vaccine available for children, it will mirror that somewhat and be expanded for children.
Great. And for folks out there, we're going to transition to our second subject. If we have time permitting, we might come back to some more health-related questions. Remember the My Turn website. From folks who have been navigating, it's been pretty user-friendly. So, make sure you go and log on and see if you're eligible and talk to your healthcare worker, because a lot of the criteria is expanding. So if we have time, we'll get to some more questions in the chat, but I know we want to get to our housing panel as well. And so obviously the state has passed some tenant relief protections. We're working very closely with the county, which also has done its own compliment. First of all, I want to say thank you to our two panelists too. So thank you. The answers were terrific, and thank you for that. And hopefully you guys can stick around if we have any time at the end. So thank you, because it was important for me as a dad to focus on kids, and I know the supervisor concurred with that. So she's nodding. Thank you. Well, the reason why I'm rushing is we're trying to get in as many questions as possible, because it's important to hear from everybody out there. So the rental assistance went into effect. As long as tenants pay at least 25%, it's been very helpful. We want to stabilize the market and protect as many tenants as we can. So thank you, everybody, for your patience out there. And it was great that the state extended it to June. With that, I'm going to turn the mic over to the supervisor to introduce our next set of speakers.
Fantastic. Thank you. Now I'd like to provide an update on the county's efforts to support our residents through rental assistance and eviction moratorium efforts. Over the last several months, the county has been working diligently to distribute nearly $110 million in emergency rental relief funds. The $110 million allocation was set aside from nearly $1 billion the county received in direct coronavirus relief funds from the Federal CARES Act. Recently, the state of California passed Senate Bill 91, which, among other things, created a new state program for additional emergency rental assistance and extended the state's eviction moratorium and tenant protections through the end of June. The new state program leverages both federal and state funding to help keep people housed and to ensure people who have been impacted financially do not find themselves arrears on their rent. The program also prioritizes households with the highest need, targeting households with less than 80% area median income, with special focus on households below 50% of the area median income and households experiencing unemployment for at least 90 days. During this critical time, as many protections have been put in place for tenants and for renters, we cannot overlook that mom and pop landlords are similarly drowning without a lifeline. This effort and the one the county recently enacted are going to go a long way to provide support for landlords who still have their own mortgages, property taxes, and bills to pay. County residents stand to receive nearly $330 million from combined state federal funding through this program. Although we always advocate for local control when possible, the county has agreed to partner and allow the state to run one singular program for county residents for both the federal and the state funding. This will make it simple and easy for tenants and landlords to find information to apply for this critically needed funding. At the county level, we are going to continue to coordinate with the state to ensure our constituents are able to navigate the process, submit the applications, and hopefully get the much needed financial relief. We've also reached out to the California Apartment Association and the Apartment Association of Greater Los Angeles to ensure that we are coordinating with them to keep their constituency aware of these programs, which will benefit many county residents. Now, we've invited two speakers from the county who are going to speak in more detail about these programs. Linda Jenkins is here from Los Angeles County Development Authority, and Dana Pratt is here from Los Angeles County Department of Consumer and Business Affairs. With that, I'd like to turn over to Linda Jenkins for her remarks. And thank you, Linda, for being here.
Thanks. I don't know if you could see me quite yet. Hello. I also want to share a screen. And I have to say, I was prepared to say many of the talking points that you shared. I don't know that I need to share much more. We could get over to the questions and answers very quickly. But let me share the screen that I have. Hopefully you can see this. Can you see it? Oh, not yet? Okay. Can you see my screen?
Yes. Okay,
great. I just want to make sure that people are aware of applying to the program that you mentioned at housingiskey.com. And if people do not have access to online, they can call 833-430-2122. And really here we need to determine that people are behind on rent or utilities, that they've experienced a financial hardship due to COVID-19, and their income is less than 80% of the area median income. I just want to describe what that is. The area median income is in fact $77,300. For a family of four, 80% of the area median income is $90,100. So just to give you an idea. And I want to also try and get over to another aspect of my screen. I hope you can still see it. When you go to housingiskey.com, it takes you over. Can you see this part of my screen? Hopefully.
Yep, we're good.
Oh, good. Okay. So what ends up happening is you come to the landing page and you can press on California COVID-19 rent relief. The thing about this is it could be open to both tenants and landlords. So as you go to this part, it'll ask you, you'll say, I'm a landlord or I'm a renter. And when you select I'm a renter, it tells you specifically what you need to meet in order to qualify. And again, they have to qualify based on income. There are documents that are identified. They will never be asked to provide anything about citizenship or show proof of citizenship, but there are documents in terms of loss of income, significant costs incurred due to COVID-19, and so you'll want to gather that information. If somebody goes in as a new applicant, they can then come to this landing page and we'll ask them if they have, if they're in one of these jurisdictions. Now you'll see under question 1, you don't see LA County, but you'll see Los Angeles as a city. If you're anywhere in the county, aside from Long Beach and Los Angeles or Santa Clarita, you'll want to definitely say no here. Do you live in one of these cities or counties? No. And then it will take you to this section, question 2. You'll want to select Los Angeles County, and I'm sure most of you that are on this town hall are from LA County for the most part. If not, go in and find the area that you are living in. And then you select your household members, and it will ask you if you make this amount, if it's under this amount, yes or no. And so you keep going through the questions and it will direct you in that way. So I want to get back to another aspect of partners that are part of this process and that can help in case people are having additional questions or in need of assistance. You might notice some of these. Family Promise of the Verdugos is local. And there's a phone number here. They may be able to assist you with applying if you're finding that you have difficulty. Chinatown Service Center, Helpline, Housing Rights Center, LA House of Ruth, Inland SoCal United Way, Shalom Center, and the YMCA of Greater Long Beach. So the phone numbers are listed here. We will try our best to get people to the right location. We are coordinating with the other cities in our jurisdiction to have the information about the program available so that there's really no wrong door. But as was mentioned, there's over $330 million available to LA County residents for the most part, except for if they're in Long Beach or the city of LA, they'll apply to those programs directly. So I will now yield to Dana because I'm sure there are many other questions that will come later, but certainly want everyone to find out more about the tenant protections that are offered to county residents.
Thank you, Linda. Dana?
Thank you so much, Supervisor. I'm going to share my screen. Nice to see you, and nice to see everyone. Thanks so much for joining us this afternoon. Okay. And I just wanted to share, so again, my name is Dana Pratt, and I am the Deputy Director for Housing and Tenant Protections for the Department of Consumer and Business Affairs. And I don't want to spend too much time here because we really want to make sure that we're addressing your actual questions, but I wanted to give a quick update on LA County's tenant protections and where we are. Let's see. Oops. Okay, and so who is the Housing and Tenant Protections Division? So we do a few things. We support mobile homeowners, park owners, tenants, and landlords who have questions or just wish to discuss potential violations of our rent stabilization ordinances for the county. And when I say the county, I mean the unincorporated parts of LA County, and as well as our mobile home rent stabilization ordinance. We also answer questions for renters and property owners regarding the LA County temporary eviction moratorium, which I'll cover briefly in a moment. And we also oversee our Stay Housed LA County program, which is a partnership with local community-based organizations and legal service providers to give residents resources and information to stay in their homes during this time. And so I wanted to just give a quick overview of the LA County eviction moratorium. I could probably spend hours going over this, and I know that there are just so many different protections and it's very confusing. We understand that, and I'm just here to say, if you have questions, please reach out to us. And so I'll try to cover it so that it's in simple terms. So what is the eviction moratorium? And again, this is for the county. It's a countywide ban on evictions for residential and commercial tenants that have been impacted by COVID-19. And who's covered by those protections? And so residential tenants, commercial tenants, as well as mobile home space renters are all protected by the county's protections. And that applies to the unincorporated areas of LA County, but also to all incorporated cities within the county. And so that's something different. And, that was done because we saw, in the county, how our residents were impacted and wanted to make sure that everyone in the county, including our incorporated cities, had those protections. However, there may still be some cities, depending on where you live, that actually have their own protections. If you have questions about that, you can go to our website, and I'll share that in a moment. But you want to make sure that if you're confused about that, you can certainly call our office, and we can help you help make sure that you understand what protections apply to you. And the other question that I get very often is, so how long are these protections in place? And so we are currently aligned with the state. The moratorium went into effect March 4th of 2020. And it's currently, the current sunset date is June 30th of this year, unless it's extended or repealed by the Board of Supervisors. And I wanted to just share two really important resources, that our renters would be interested in. So the first is our Stay Housed LA County program. And so this is something that was a huge partnership in the County of Los Angeles, the first really of its kind locally. And it's a partnership, again, between my department, which is DCBA, and tenant-led community organizations and legal service providers. And what we're doing is providing tenants with information and services that they need to exercise their rights and remain safely in their homes. And what does it include? So it includes a few things: limited and full scope legal representation, short-term rental assistance, so up to 3 months or $7,500, some virtual Know Your Rights workshops, and also referrals to financial, legal, and other resources that tenants may need at this time. I did want to make a quick note about the rental assistance. This is separate from the state's rental assistance. So you would still want to reach out to the state. I think that there's the potential to actually get more relief there. But this is something that you can also access if you're coming to this program. And then I really apprecited your earlier comments, Supervisor Barger, regarding our mom and pop landlords. And I wanted to just make sure to mention that coming very soon, we will actually have a mortgage relief program launching in the county. And so that came out of a motion from the board to create a mortgage relief program to make sure that our mom and pop landlords have some sort of relief due to the impacts of COVID-19. And what it's going to do is expand housing counseling and outreach services, and also provide up to $4 million in direct financial assistance to qualifying property owners. And so for more information on that, you can please contact our foreclosure prevention program at 833-238-4450. And then I wanted to close with just giving our contact information. If you want to contact my team, the Housing and Tenant Protections team, you can reach out with any general questions that you have. We also answer just general landlord-tenant questions, even if it's not related to COVID. And so you can reach out to us at 833-223-RENT or 7368. You can email us at rent@dcba.lacounty.gov, or you can visit us online at rent.lacounty.gov. Thank you so much, and I will turn it over to you for any questions.
Great. I think we're going to go right into our questions. Thank you to both of you for presenting. Our first question is, I'm a single mother with by the way, all the questions came from the folks, the public. They were not generated by us. We wanted to make sure we got to your questions. I'm a single mother with a special needs child, and I'm very worried about eviction due to unpaid past rent. I was able to keep current until September 2020, until I lost my job due to COVID-related business closures. I owe past due balance on my electrical and gas. I've paid the state mandated 25% of rent since September, but if I do not get assistance for the months of September through March, I could be evicted. What assistance will the new rent relief program provide me, and what other programs can people in my situation access? So it's sort of an overview to pay past due bills. Who wants to do that one?
I'll answer that one. I would suggest that this interested constituent apply to the state's program, as I had mentioned, at housingiskey.com. And the type of assistance that is available, and I'll just reiterate, the program provides rent reimbursements to landlords for unpaid rent accrued between April 1st, 2020 and March 31st, 2021. What will happen is the landlord is provided with 80% of the rental arrearages, with the agreement that 20% of the rental arrearages will be forgiven. In terms of the utilities that are unpaid, 100% of the utilities can be paid. And I'm assuming that this person has in fact will meet the income criteria based on the way that you've described. And so that is there. In addition, prospective rent can be paid forward for a period of 3 months, but it will only be the 25% of the rental amounts for those 3 months. But that is available.
Thanks, Linda.
Thank you. The next question is, will the state's program, which is aimed at lower area medium income levels, help prevent more people from falling into homelessness?
This is tricky. I say that only because the program is available and is available to people to hopefully prevent them to going into homelessness and being evicted from their homes. But there's no guarantee in that. And we really have to see what the overall response is, how the state program will be able to assist, how the county has been able to impact the lives of the residents that we've assisted so far. And hopefully with the variety of programs as well as the tenant protections and Stay Housed LA, we can hopefully stem that flow of people into homelessness.
Great. I'll go to the next question. What relief, if any, is the county providing for landlords who are receiving only minimal rent or no rent at all or for past due year? And must meet their mortgage? You touched upon this with the upcoming mortgage relief, but do you want to, the 80%?
Sure. So I can, I'm happy to take this question. So we really do know that, our landlords have been, hit just as much as, in some cases as our tenants. But it's really important that you reach out for assistance. Please call our office and I'll drop the information, in the chat, and I'm sure that the slides will be shared as well. So we have this new relief program that will be launching in the coming weeks. So please stay tuned for that. And then if you have past due rent, please reach out to the state, because you can get, 80%, of your rent being reimbursed is just huge, especially for some of the property owners that may not have received anything since March of last year. So that, I think that is really important to note.
Great. And if my staff could put our office number in the chat too, as you navigate the state system, if you need assistance, reach out to my district office as well, and somebody will get to you. Supervisor?
Right. Yeah, the next question is, and this is a really good question, is this new rent relief program reserved for those who have not already received assistance during the COVID-19 pandemic? If not, can you explain some of the parameters of the program regarding past assistance?
So yes, that's a very good question. At this point, I have not heard of any limitation. And we have, in fact, shared information with the state in terms of those that have received assistance through the county's program. We're trying to also gather information from other programs within the county, such as within our cities that have been providing their own programs. But I think that at this point, if there is still unpaid rent and utilities and you need help, to please apply to the state's program. If you meet the requirements, they will be able to help you. Hopefully that there's sufficient funding there with over $330 million. Also, if for whatever reason the landlord is not willing to participate, direct to tenant payments will be made, but that's 25% of the rental arrearages. You'll need to make sure to get the rent receipts on that, but that will help prevent you from being evicted based on the tenant protections of SB 91. Hopefully that answered your question.
Yeah, thank you, Linda.
Great. We're obviously getting a lot of questions on the tenant side, on the landlord side as well. Is there anything else as far as the landlord piece that we haven't covered? Do either of you, we've talked a lot about it. Is there anything we've missed on the landlord piece?
I think that the main thing here is that the landlords can apply, but their tenants must qualify in order for them to receive payment. And from what I viewed with the state system, and this so that both for the landlords and the tenants, they will not be able to view each other's information within the database that the state has. So there should be no fear of that in terms of personal information, bank routing numbers, tax ID numbers, crossing in any way. But what will need to happen is the landlord will need to identify the tenants so that the state can reach out and obtain that information so that we can make sure that the state qualifies those tenants. And so that's what I have. And then, of course, Dana had mentioned there's the mortgage relief program that they're standing up here shortly.
Great. And I know we've received some questions about small businesses, and you all know
I can answer that. Yeah, go ahead.
Yeah, I was going to say the state just reloaded the small business relief to the tune of $2 billion. And if you applied in the first round, you get carried over into the second round. Unfortunately, nonprofits have to reapply, but the small businesses that didn't get the first grant can get up to $25,000 from the state. So make sure you take that. And Supervisor, you want to take the question and then do the last question, and we'll see if any of our health experts have any last thing that they thought of from the chat. So Supervisor, you go.
So on the small businesses, we are going to be reallocating or allocating our new CARES Act dollars from the federal government. And our goal is to create something similar to what we did early on, and that is grants for small businesses. And the goal is we will allow that to be used toward rent. And so that's what we're putting together. We're finalizing it within the next couple of weeks. So we are prioritizing small business as well. This pot is not going to be used for that, but we are going to look within the county to another grant for small businesses, recognizing the hardships that they've faced. And so the I've got this question: to provide housing stability, will there be legislation or mandates for landlords to issue a lease to current residents who never missed a payment during the pandemic at the current market rate? Will legislation curb landlords from increasing rent beyond today's market rate once evictions begin? And I think on the second part, rent control, there's a cap on how much landlords can increase rent. So that's already in place pre-COVID-19. But as it relates to leases to current residents, I don't know if Dana or Linda, you have an answer to that. And if we don't have an answer, we put the information in the chat where you can reach out. Do either of you know?
Sure. I don't. Yeah, I do not have I don't have an answer to that, at least not right now. But please, stay tuned. And, there are so many new bills being introduced daily. So.
Well, yeah, a lot of this is evolving. So it's a good question. Thank you. We've got 3 minutes left, and I don't know if our healthcare experts have any last minute thought that they want to add, and then I'll ask our housing folks if there's anything we missed as well.
I saw a question in the chat about the effectiveness of vaccines, and even if you fall into that 5% where it's considered not effective, does it still protect you against hospitalization and death? And so I just wanted to briefly, can you see this? I just want to show you this slide because I think that this is a very important question. That you can see these are all the vaccines: Pfizer, Moderna, AstraZeneca, Johnson & Johnson, and then severe disease in prevention and clinical trials, 95%, and all this. Hospitalization and death across the board is 100%. So you should get vaccinated with any of those vaccines. And from what we know so far, all the clinical trials, protection against hospitalization and death is 100%.
100%, yeah. Thank you very much. That's a very important point. Really appreciate it. Do our housing folks have any last parting thought?
I saw a question that asked about income in terms of income tax. The latest program, it would be the 2020 tax return or whatever their current income is now, and it would be based on more current payment stubs if they have them, and certainly what their income is right now. So it will take 2020 tax returns, not 2019 tax returns. So hopefully that answers that question in the chat.
Great. Supervisor, do you want to have a parting thought?
Yeah, I just want to thank all the panelists. You all are amazing. And, I appreciate the work that we're all doing. This is one of, I think, another forum we're probably going to have, Senator, because as we move toward vaccinating the county and getting people back to work, there's going to be a lot more issues coming up, and we're all in this together. And I say that because we are, and I want to thank Dana and Linda for taking the time as well from the county. But I want to thank you, Senator Portantino, and your team. Because you've been a true leader and someone that I'm honored to work with.
No, thank you, Supervisor, and I'm glad you mentioned our staffs as well. We are on camera, but there's a lot of preparation that goes into lining up our experts and going through the questions and making sure this all comes together. And we try to keep these around an hour because we want to, we know people are busy. And we'll do more. And if you didn't have your question asked or answered, reach out to the comments that are in the contacts that are in the chat. We'll be happy to answer your questions going forward or help you navigate any of the systems on the county side or the state side. And thank you to our 4 panelists. You were great, and happy to partner with you all day long, Supervisor. And thank you, everybody, for tuning in. And this will be available on our websites and social media. If you want to hear the questions over or refer to anybody else, you can just share our website and social media platforms to share it with other folks. So thank you, everybody, and be safe and get vaccinated when you can.